Thank you for joining us today. We're going to be talking about memory and ways to support your brain and memory naturally. This is such a fun experience for myself and Dr. Rosalie de Lombaert, who is my colleague here at Prosper Natural Health. We are naturopathic physicians who love to just dive into the primary literature and really share with our community and our patients some of the newest research that's coming out. There's so much being learned in natural medicine right now, and it's a pleasure of ours to get to be kind of at the forefront of that and help our patients move through whatever their health challenges are with some of the new information that's unfolding. So we've got a clinic at Prosper Natural Health, which is in Port Townsend, Washington. And we just love seeing people for all different kinds of reasons. We kind of consider ourselves family practice in that we see older people and younger people and people from all different walks of life and different needs as far as their concerns, their health concerns. But today we're talking specifically about memory, which often we think about in association with aging. Now, one of the things that we do is we provide these free monthly talks. And in these talks, we're really trying to think about questions that are coming up in our clinical practice and how we can really support our community and our patients once again with some of the latest and greatest information. So today our goals are going to be to look at memory and specifically think about ways that we can see shifts that might be happening before we have a full impairment of that memory. So we're looking for things like risk factors, slight changes, and we want to talk about ways that we can assess those things and diagnose those things. But most importantly, today's talk is going to be really focused on new findings and really cool non-pharmacologic treatments. That means not using kind of our standard drug model in order to treat memory and support memory and brain function. So we have to start by looking at what structures are involved here. So we're starting with looking at the central nervous system. So the CNS is going to pile of your brain as well as your spinal cord. Now, we take a moment to think about what the brain is composed of. And this is important because the function of the brain is going to become very dependent on some of that. So we want to remind our patients and everyone listening that the brain is primarily composed of fat. And that's going to include the myelin, which you may have heard of. This is what helps insulate the neurons, and the neurons are what are helping send the signals through the nervous system. Now, 20% of our brain is made up of water. So really important that we have the proper hydration. And then 10% are made up of proteins. And we're going to be talking about some really cool key proteins today that can impact brain function. Now, less than 5% is made up of carbohydrates. And we think about that because the brain in particular likes glucose. It likes sugar in particular to help it function. And then the other less than 5% is made up of different minerals that are often acting as cofactors so that these neurotransmitters can do their job and communicate appropriately. And that's important because the base takeaway from that is we need to make sure we have healthy fats in our diet. We need to make sure we're hydrated. We need to make sure we're getting adequate proteins and able to conjugate them. That means our liver and kidneys have to be involved in that. And then we need to make sure that we have enough glucose in our system. So that means our blood sugar being nice and stable and regulated for our brain to function. And then we need those multi minerals and those nutrients that are cofactors that help us with these pieces to function. So when we're thinking about the different brain regions, it's very complex. There are different functions in each. And depending on what is happening for someone's memory, this becomes really important for us as clinicians because we need to be thinking about what types of memory deficits they might be starting to have, or different personality shifts or moods that are really being affected for them So this is important for us to know as clinicians, and we're just going to quickly review it with you. We want to remind everyone that the frontal lobe is really the area of the brain that really helps us with decision making. This is the one that helps us determine some of our personality traits. It also is involved in things like talking and even movement. Now, the parietal lobe on the sides are even more so involved in things like spatial relations, our ability to identify objects, to see the yo-yo and say, oh, that's a yo-yo. The idea of pain and touch interpretation is there as well. And then even speech and recognition of speech also happens there at the parietal lobes. Occipital lobe, which is closer to that back, is involved with vision. Now, our temporal lobes as well are going to be involved in shorter term memory, our ability to bring back short term memory, and auditory, the musical rhythm piece. Cerebellum, which is right here at our base, is going to be involved in our balance and coordinating movements and our ability to understand kind of where we are spatially. So these are important because when we're thinking about changes in brain function, different areas are going to start to tell us what is involved here by looking at what might be changing for the person.
So when we're thinking about symptoms of cognitive impairment, like Dr. Molly said, it's really important to think about where are the deficits, because that tells us where in the brain we're seeing essentially some atrophy over time. So part of the way we assess brain function is just a multi-prong approach, right? It takes a couple of steps in order to make the diagnosis of cognitive impairment. Of course, there's the personal individual assessment where the patient themselves is thinking about, I am noticing these changes in my mental emotional sphere, or I am having these physical symptoms of like a change in my sense of smell or sense of hearing, right? So it's an individual assessment. There's also familial and social assessments, because sometimes, actually quite commonly, the individual is unaware or perhaps in denial of these changes happening. So it's their family members that say, hey, I've been noticing you've been forgetting where your keys are all the time, right? Or, your direction, or you haven't been following the directions on your drive home quite as easily as before, right? So that's also an important sphere to take into consideration. Thirdly, there's the clinical assessments, just with the primary care physician on board that are just your regular screenings. Different ones that are available are the MMSE or the MoCA testing. These are things we would administer in office, just essentially little quizzes that give us a sense for, okay, which part of the brain are we noticing some deficits? Then, of course, there's blood tests, because sometimes there's clear physiologic causes as to why there is brain fog or memory issues, things like anemia, right? So, of course, this would be a workup with the primary care physician. And then if we do notice these things, it would behoove us to send the patient over for specialty assessments, right? With a psychiatrist, a neurologist, or a gerontologist, where they do a neuropsychiatric assessment, a more thorough, maybe hour-long assessment of like what's going on with the brain, including some really important neuroimaging, where we assess the brain matter with an MRI or a DAT scan. This would tell us about dopamine. These would be ways to actually get to a diagnosis that says, yes, Alzheimer's, or yes, Parkinson's, or yes, dementia, right? So it takes all of these into consideration. So some early signs of cognitive impairment. This is really important to track, because in the early phases of brain changes, that's where we can see the biggest effect of treatments, right? We absolutely want to catch this early before a diagnosis can be made. So the diagnostic term here to consider is MCI, mild cognitive impairment. That's just basically a pre-diagnosis, kind of like pre-diabetes or something, before the actual true diagnosis of dementia. So the regions of the brain that are affected are determining the symptoms. So common symptoms, especially noting a change from before, is forgetfulness of items in a room, of words, of people's names, missing appointments more frequently or social engagements, trouble finding your way around, especially in regards to directions, losing your train of thought, especially mid-sentence or mid-conversation, trouble following conversations or plots of books or movies. This is a really common one that I see, especially with, maybe it could be described as like patients or family members just zoning out, right? They're sort of disengaging. That's an early sign of cognitive impairment. Difficulty following instructions, making decisions, or even finishing tasks. Again, you need a whole lot of focus and brain power to do these things. And with cognitive decline, we see these start to fall by the wayside. Personality changes are present as well, including impulsive behavior, irritability, or poor judgment. And then again, thinking of this as a change from before, you might see a sudden uptick in dementia, anxiety, short temper, anhedonia, which is lack of interest, right? These are all signs of there being changes in the brain. So dementia is the next step up, right? We talked about MCI, mild cognitive impairment, and then dementia is the next step up in terms of the diagnosis. It's an umbrella term, which means that there's a bunch of different diagnoses that are present under this larger umbrella. We can make the diagnosis of dementia when we are noticing the symptoms affecting your ADLs or your activities of daily living. So all of a sudden, we get to this place of, okay, symptoms are significant enough that there needs to be someone else present that's starting to help the individual with their daily activities, whether it's remembering supplements, remembering to make meals, or showering. These are kind of your activities of daily life. It's worth noting that 55 million people are affected globally with dementia. So it's just a big burden ultimately. And the most important piece here is trying to identify the signs early. If you look on this image to the right, you can see that within the umbrella term of dementia, there's Alzheimer's disease, vascular dementia, frontotemporal dementia, Lewy body dementia, a whole bunch of other different types of dementia. Again, this is sort of something a psychiatrist or a neurologist would start to diagnose. So we're thinking about what are the brain changes that we see physiologically in these cognitive decline diseases. So it actually has to do with varying degrees of atrophy, which means basically a shrinking of the brain matter, whether it's with the white matter, it's the sort of the fatty layer, the myelin sheath. If you are familiar with doing electric work, of course, you've got your wire that's conducting electricity, and around it is the sheath that protects the electricity from going other places. We have the same sort of system in our brains. This white matter, this white myelin sheath is helping conduct that electrical impulse where we need it and not having it lost other places. Loss of neuronal connections is also huge. So all of a sudden there's a decline in those neurons, those cells that conduct the electricity, the impulse between brain cells. This is a huge change that we see. And then, of course, there's other dementias that have to do with inflammatory changes. Inflammation in the brain leads to tangles of different proteins or plaques, just inflammatory tissue that basically muddy the way that the electrical signaling can happen. So all the way on the bottom right, you can see the sort of atrophied brain due to dementia and specifically Alzheimer's disease. This white matter really shrinks. So now that we've talked sort of about diagnoses and early symptoms, I want you to be aware of the risk factors that are present that can very much contribute to future risk of cognitive impairment. So, of course, genetics. If there's dementia in the family, there's a big genetic piece here. It has to do with like how the brain deals with toxins. And some brains do sort of create proteins, these inflammatory proteins, a lot easier and quicker than other brains. Air pollution has been identified as a risk factor for cognitive impairment, as well as diabetes. Think about diabetes as being, a state of there being high sugar in the in the vascular system, and this affects the organs that require a lot of vasculature, including the brain. Physical inactivity is a huge one. The sedentary lifestyle is a huge risk factor for cognitive impairment. Smoking, of course, very inflammatory. Alcohol consumption as well. Social isolation is a huge one I see, especially in my elderly patients, that are a huge risk factor. Hearing loss, vision loss can be part of that early symptom, those early symptoms. History of traumatic brain injury, whether it's concussions through sports or motor vehicle accident or falling off a horse. These are all ways these sort of these brain bruises over time definitely can contribute to cognitive impairment. Midlife hypertension, curiously enough, has been seen as a risk factor, as well as midlife obesity and midlife high LDL cholesterol in particular, which is the sort of bad cholesterol or your low density cholesterol. And then lastly, big risk factor here is late life depression. So, we're thinking about, again, trying to find a way to prevent the cognitive impairment and catch things early. That's just key here.
So when we're thinking about ways to catch these signs of these changes early, one of our best and most cost-effective tools are standard blood work and sometimes urine work. But often we're looking towards blood work with this, especially when we're thinking about cognitive impairment that's because of changes for the vasculature and the brain to be able to get the nutrients that it needs. So that's where we think about looking at our lipid panel. Dr. Rosalie had mentioned the cholesterol being a risk factor there. We also want to check and make sure that blood sugar is regulated. That's where our hemoglobin A1C and even our fasting blood glucose markers come in, because remember, those sugars circulating in a diabetic state or a high blood sugar state is going to cause damage to those vessels that bring nutrients to the brain. CMP is on here because that's our comprehensive metabolic panel. That's one that's making sure our electrolytes are balanced, our blood sugar's balanced, and that we have adequate action of our kidneys and our liver. Now, inflammatory markers such as LDH can be very helpful for us. Sometimes we also look at things like CRP. These inflammatory markers help us look and make sure that there's not active inflammation, and we know that inflammation can be very damaging to the brain. Thyroid screening, also looking at what's going on with metabolism and if our brain is going to be getting some of the signaling that it needs. We also want to be checking and making sure that our patients aren't anemic. CBC is very crucial for this because, once again, if we're not getting enough blood and oxygenation to those tissues of the brain, the risk of atrophy is greater. And remember, that's that shrinking, that downsizing that can happen. Ferritin here is a level of our iron stores, and it can also be a marker of inflammation. So we always like to check that at least annually, once a year, and then iron as well, making sure that iron levels are adequate to make sure our patients aren't anemic. And then hormone testing can be helpful as well for some patients. We know that hormones are absolutely involved in neurotransmission and how the brain is stimulating. So one of the things that we can offer our patients is a what we call the Prosper Annual Panel, and this is a very inexpensive test that allows us to do a whole host of these different analytes, these different tests, and we can get a really whole picture of what's going on for our patients. Even if they don't have great insurance coverage for testing, we can still get a really good idea of what's going on and check those pieces that could be involved in memory and brain function changes. So the other piece here is specialty testing, and sometimes we find that that can be really helpful for our patients, and specifically, we'll often look at two. Now, one of these is the SpectraCell analysis of nutrient deficiency. This helps us look at nutrients and understand if a patient has enough of those minerals involved and enough of those cofactor vitamins involved, as well as some of the fatty acids that are critical. And this can help us understand if there are these really critical nutritional components that are not coming in for some reason for the patient, and that could be maybe a source of why they're having cognitive changes. The other option for us that we'll sometimes look at with patients is looking at different antibody testing to understand if the patient might be having an inflammatory reaction or even a concern for us of blood-brain barrier permeability. And this is a really important component that can affect inflammation and rapid cognitive decline. So we see this especially in our patients that have history of traumatic brain injury or major infections, and those causing inflammation and causing neural changes that can be chronic and long-term and progressive. So we always like to check that if we're concerned about that with patients. The other very cool thing that we have offered to you guys is we did a very comprehensive talk all about memory and dementia support that was done back in 2022. And this goes into much more detail, greater detail. So if you're interested in what we're talking about, please check this out. It's on our website at prospernaturalhealth.com, and you'll see it there under that Doc Talk Educations tab. And in this talk, we really break down some of the key components of what can be causing these kind of cognitive shifts, ways to detect them early, and a better, more complete understanding of the physiology behind that. And we go through several different treatment options as well. But today, we're so excited to share some of this newer literature, and this is really the update to that prior talk.
So indeed, yeah, like Dr. Molly mentioned, that prior doc talk from 2022 is more kind of bare bones introductory, and this doc talk is sort of building onto that. It's our medical deep dive into the primary literature, looking into that scientific data for you. We've got a few articles we're going to highlight here in terms of the nutraceuticals and herbs. So one of my favorite herbal protocols to start with when I have a patient with early signs of cognitive decline is just reaching for my Ayurvedic herbs. So the particular ones that end up being well studied here are ginkgo and bacopa, ashwagandha, as well as coffee fruit. So this combination of Ayurvedic herbs, as we'll see later, gets compiled into, a supplement form. But ultimately, this particular research article from 2023, a systematic review, which means it looks at a whole bunch of data and then takes that information and boils it down into a statistically significant finding. Indeed, they found that these what are called nootropic herbs from the Ayurvedic repertory, nootropic meaning helping with the building the nerve tissue, were indeed found to be helpful and statistically significant. So again, that's ginkgo, bacopa, ashwagandha, and coffee fruit.
Here we have a really cool research study that came out just in 2024 here on magnesium threonate. Now, we know that there are several different forms of magnesium, and we know that magnesium can be very impactful on the brain. It's one of those critical minerals that's involved in the brain. But what this study showed is they were looking specifically at the form of magnesium called magnesium threonate. Now, this is a very specific form that we often associate being helpful for things like migraines and some brain function. And this was a really cool study showing that what it's doing as magnesium threonate is actually modulating the microbiota. So the probiotics, we think, right? The flora in this communication between the gut and the brain. So we call that that communication highway, the gut-brain axis. So this study was looking specifically at Alzheimer's disease, and it was saying, how is magnesium threonate actually affecting and improving cognitive deficit? And it was showing that it helps reduce apoptosis, which is a programmed cell death of this hippocampal neuron. Now, the hippocampus is that brain structure that Dr. Rosalie had shown you guys earlier, and showing that it really, especially in Alzheimer's disease, gets smaller, it shrinks and atrophies as the disease progresses. So this actually helps reduce that shrinkage and that reduction in size of the hippocampus. And this was shown to have this neuroprotective effect against oxidative stress as an antioxidant as well. So very cool research here about this simple form of magnesium.
So here's a research article from June of last year, 2024, on the neuroprotective effects of turmeric. So again, our Ayurvedic herbs kind of shining through here, but curcumin, which is the anti-inflammatory constituent derived from turmeric, has been seen to have neuroprotective properties, in particular by modulating the inflammatory pathways in the brain, what are known as your neuroinflammatory pathways. What turmeric and especially curcumin does is it scavenges the reactive oxygen species, which are basically a physiologic response to inflammation. And it scavenges those, so it basically takes the inflammation and downregulates it. And then it inhibits the body's pro-inflammatory cytokines, which are those little molecules that are part of the inflammatory cascade. So it basically, the way that it works is by diminishing inflammation. And we know about turmeric's use in musculoskeletal complaints for this, but it's also really very much applicable to brain inflammation as well.
This next study was done in 2021, and what it was looking at is a specific type of choline, the citicholine, and this one was used for a 12-week trial in older adults. And what's so cool about this study is that it was done as a double-blind, placebo-controlled clinical trial. So this is one of our best types of clinical trials, right? And it was also randomized, so even more strong as a study. And these older adults were given 500 milligrams of this citicholine a day for 12 weeks. And what they found is that it helped improve their overall memory performance, specifically with these episodic memory lapses. So helping them with that, and this was done in both males and females, and it's because of it was registered as a trial. And from there have been many supplement manufacturers now who are using this as part of their strategies to help out with memory loss and memory decline.
So this is an excellent study here. I'm so pleased to come across this one. It's research on the polyphenols, in particular from coffee fruit and resveratrol, which is an extract from grapes, grape skins. So polyphenols are excellent antioxidants. They're found in a whole bunch of fruits and vegetables, right? And so we've got to think about this from that perspective too. But dietary polyphenols here were seen to be an effective strategy to tackle the multifactorial causes for Alzheimer's disease. Right. So polyphenols, remember, like I said, not just coffee and grapes, but think about all your berries, all your deeply colored fruits and vegetables. So if you've been in my office, we probably have talked a whole lot about how to increase the rainbow of foods in your diet. The rainbow of foods are your polyphenols. They're these excellent antioxidants. Antioxidants, remember, have to do they're not only sort of building blocks for the cells, but they also help with inflammation management. So a huge part of cognitive decline is this wrangling of the neuroinflammation that happens, diminishing inflammation in the brain. So whether you do that from coffee or grape derivatives is up to you, but it's ultimately the bigger piece here is those polyphenols from the rainbow of colors of foods.
Here we have a study that was done on acetyl L-carnitine. Now, carnitine, you might have heard that term. That is it's an amino acid. This is a specific amino acid. Often we're getting this in meat proteins, especially red meat proteins. Now, what they're finding here with this specific amino acid is that it's pretty phenomenal in that it is neuroprotective. So that means it's going to protect those brain structures. It's neurotrophic, which is going to mean that it's going to be helpful for the modulation of how the brain is functioning and working. And it's even antidepressive. That means it helps lift mood. And then we even see an analgesic effect. That means it helps support against pain, right? And we already knew about that in some areas of what we call painful neuropathy. So that means where people are having pain because of the nervous system sending those signals. But now the study is saying that this acetyl L-carnitine as a solo amino acid also has this antioxidant protection, which is exactly what Dr. Rosalie was talking about, scavenging those free radicals. And it helps with this protection of the breakdown of these cells. And it also helps with the mitochondria of these cells and metabolism. So that means that's like the powerhouse or the energy production of these cells, which is a huge deal when we're talking about anti-aging strategies and also reducing neurodegeneration or breakdown that happens when we're worried about things like dementia or memory changes. And this can help slow that deterioration. And the authors are suggesting that's because this amino acid may go in and actually modulate the way our genes are signaled and programmed to turn on and off. So really phenomenal. The other component that this simple amino acid does is it can affect the morphology of the synapses. And so that means how the little pockets that between the neurotransmitters areas where they have to kind of dock and be picked back up by the next nerve, it can actually affect what shape those are and how those are effective at sending the signaling. So that means that the transmission of the signals, if we think about this almost like an electrical system, is going to be more effective and can even be recorrected or remodulated. We're always talking about the brain being plastic and having the ability to relearn, rewire. That's kind of what this study is nodding towards in regards to acetyl L-carnitine, which is just great because it's a pretty inexpensive amino acid that we can either supplement with or really make sure we're getting nutritionally.
So remember the brain components, right? 10% are these proteins. and 60% of the brain is fat. So, of course, here's some research on a type of fat that helps with the brain. So, phosphatidylserine is a type of phospholipid, which is a type of fat derived from soy products. And what it does, what we've seen in the primary literature here, is it has a role in several cerebral functions, especially in regards to uh, signaling pathways. So it activates signaling pathways, it modulates that neuroinflammation, it supports neurotransmission, again, the message from one neuron cell to the next one, and is involved with synaptic refinement. Basically, how do we connect the electrical system even better? And so super supportive, of course, you can imagine this type of fat being helpful for the fatty tissue that is the brain. Yeah, in phosphatidylserine. I've seen this also be very helpful in other neurotransmitters, including cortisol regulation, right? So it's just when to have on your radar.
And we want to take a moment and look through some of the direct clinical tools that Dr. Rosalie and I are using at Prosper with our patients. We have both an online apothecary that you can go to through our website at prospernaturalhealth.com, the e-store there, and we have an in-person apothecary here in Port Townsend. We will say that when we're choosing nutritional supplements or even nutraceutical supplements for our patients, we're always doing so with a tailored approach in mind. So these are very individualized recommendations that we're giving to patients. And today we're really just highlighting a few of our favorite tools that have really cool new literature on them. So we want to make sure you guys are aware of them, but by no means is this the end of our kind of like toolbox here for how we are looking at, dementia and cognitive stuff. For example, we're not even going to really get into fish oils today, but that's a really important one. Mind you, we have a whole doc talk on fish oils, so we'll encourage you to go check that out. But they're more than just these few supplements. We just wanted to make sure you guys kind of understood the nitty-gritty about some of these that we use. So one of our favorites is a combination herbal product with proteins in it called Brain Vital. Now, this one has that citicoline in it. It also has the ginkgo that, remember, helps with that vascularization of the brain. And it has the phosphatidylserine, which is that strong antioxidant as well, and going to be so important for that brain function. This one also does have some coffee fruit derivatives, so we think about those polyphenols, but we also think about how that might be affecting our patient, and this might be appropriate for some and not others. This is one of our favorites when we're looking at things like certain vascular dementias, that kind of support we're looking for. Now, Cogni-Aid is another one. Both of these are made by Designs for Health. What they've done here is they've combined bacopa, which is one of our herbs that's often used traditionally for memory, with ginseng and ashwagandha. These are both very strong and adaptogenic herbs that we think about for regulation of cortisol and regulation of our stress system and even our blood sugar system. And we also have huperosin A in here. So all of these are going to combine to work in a very different way than the Brain Vital, but can be very helpful. Polyresveratrol SR is another product that we've used for years and years through Thorne. Now, this one looks specifically more at that antioxidant picture. How do we reduce inflammation that might be happening in the brain pathways? And how do we calm that down to reduce damage that's being done? We talked about the L-carnitine, and you can see that acetyl L-carnitine there listed as well. And that one, once again, is going to be so important for that signaling and for the ability for the brain to have the ability to mend itself in the signaling realm. Now, when we're talking about cell rescue, that's a product that has turmeric and several other anti-inflammatories that are also antioxidants in there. And that is, once again, another really powerful component for us when we're thinking about different reasons that someone may be experiencing cognitive decline. And then, of course, that magnesium threonate is yet another support that we'll use because we know how strong that was in the clinical realm too when we look at that literature. And that is one that's a simple mineral that we can often add in for patients who are in need of that. Dr. Rosalie, is there anything else you wanted to add about these tools?
Just the multifaceted approach with these nutraceuticals, you know, Cognaid being kind of your traditional Chinese medicine Ayurvedic blend. These other ones being more sort of extracts from foods, right? Whether it's your rainbow foods or your proteins. So, you know, like Dr. Molly mentioned, it's very much an individualized approach with patients, which ones of these or other supplements that we end up using. But this is kind of just a place to start.
And we're often looking, once again, not just at what we're getting from the information from our patients or their family members about what is going on for them, but also looking at that blood work or other labs to kind of help us really focus and tailor their approach that's needed here. So our next Doc Talk coming up next month that will be released on that second Thursday of the month is going to be all about oxalates. Now, some of you might be saying, what's an oxalate? Oftentimes we're thinking about oxalates being a problem issue when we're trying to eliminate them through the kidneys, through the urine, and they can be binding from other foods and create stones in particular, or even gravel that has to be passed through the urinary system. And that can be very impactful on the kidney's ability to detoxify and to even urinate. So there are many different reasons for oxalates being a problem for someone and ways that we can help identify them and reduce them and help people have a healthier urinary system because of that. So we'll invite you to keep an eye out for that talk. And we look forward to being in touch with you all. If you have questions, if you're concerned about yourself or a family member or even a friend about memory, we are here. This is something that we absolutely love to do for patients, is to really help get them back on track and to be supportive in that process with natural therapies. So please reach out to us. You can book an appointment online at prospernaturalhealth.com, or you can give us a call and get scheduled that way. We look forward to hearing from you. Thanks for joining today.